This is a video of an ultrasound-guided percutaneous radiofrequency ablation of a parathyroid adenoma in the setting of primary hyperparathyroidism. A 67-year-old female had a diagnosis of primary hyperparathyroidism based on elevated calcium levels and non-suppressed parathyroid hormone level of 106. She had a history of osteoporosis, and the ultrasound showed the presence of a left inferior parathyroid adenoma that was subsequently confirmed on a 27-gauge ultrasound-guided needle biopsy and parathyroid hormone washout. Patient was opposed to the prospect of surgery and was offered radiofrequency ablation as a possible alternative. Left inferior parathyroid adenoma is close to the tracheoesophageal groove, which is the anatomical location of the recurrent laryngeal nerve. Thermal injury to recurrent laryngeal nerve has been reported using radiofrequency ablation. To protect the recurrent laryngeal nerve from thermal injury, hydrodissection is a well-established technique that has been used successfully in the past. A 25-gauge needle was used to slowly inject cold D5W around the adenoma, and the adenoma was dissected away from the tracheoesophageal groove. An 18-gauge radiofrequency antenna with a 0.5 centimeter active tip was inserted into the parathyroid adenoma under ultrasound guidance using the trans-isthmic approach. Once the active tip of the antenna was in position, 35 watts of energy was delivered and continued until microbubbling was noticed, which signifies ablation of the target tissue. Patient's voice was monitored every 1 minute to ascertain the possibility of any thermal injury to the recurrent laryngeal nerve. After successful ablation, parathyroid hormone levels and calcium levels were drawn, which showed normalization of both levels. Patient experienced no side effects and her voice remained normal.